I did a video about sun damage for facial aging, and I did another video on the longevity of results both for hair transplants and facial work. I'm going to talk about one thing I hate, which is testosterone, exogenous testosterone. Of course, if you're going to a low T clinic, as they call them, they're going to sell you that you need to have testosterone. Am I opposed to testosterone across the board? Do I think it's absolutely wrong for you? No, not necessarily. If you don't have a genetic predisposition toward hair loss, or if the testosterone is not causing progression of your hair loss, then I think it's not necessarily bad. I mean, in terms of whether it's helping you in terms of your lifestyle or whatever your hormonal health, that's going to be up to you and your testosterone doctor. It's not for me to advise you whether to take it or not. But as a hair transplant surgeon and someone who cares about hair loss, I think testosterone is a terrible thing in terms of hair loss, especially if you're already in my clinic wanting to talk about a hair transplant. It is like adding fuel to the fire, and also on top of that, if you're not taking medical therapy to blunt the effects of DHT, dihydrotestosterone, and you're just on testosterone, that can be a problem in terms of progression. I recently did a transplant on a gentleman at 62 years of age, which is a great safe age to do a hair transplant, and I still think he's a safe candidate. But he's had 2 transplants in the last 10 years, and he's only started to see hair loss at 49 years of age. That's pretty odd to lose hair at that for the first time in your life starting that age. You can have it. There's even a condition called senile alopecia, which is a terrible term, where you can start losing hair in your 70s and 80s and you don't have it beforehand. A great example that they've done classically is the actor in the 1980s and 90s called Don Amici, who had a full head of hair until his 70s and 80s and started losing hair. But that's pretty uncommon. What's more common is for young men to lose hair, and that hair loss starts to slow down. So this gentleman, he started losing his hair at 49 years of age. Why do you think he started losing his hair at 49? He started testosterone therapy at 49, and that's the problem. And once you lose that hair, it can't come back unless you do surgery, unless it's just miniaturized, and maybe some medical therapy could catch it. I had a gentleman that I did a consult recently, a phone consult, and he started losing hair in his 30s, and he's now 40, and he's already lost a substantial amount of hair, and guess when he started testosterone? In his 30s. The benefit of a testosterone reduction when you hit your 40s is that it actually starts to slow down hair loss. That's why a lot of men who are not on exogenous testosterone, they oftentimes see that their hair loss progression slows down, even if they're not on medical therapy, but medical therapy helps in those that need it. That's finasteride, minoxidil, etc. So that's very, very important to understand it. Now, the question that I always get is how much testosterone is safe? And the problem is we don't know, because it's based on your genetic sensitivity, and that is a huge component. So you could have taking exogenous testosterone, you have progressive hair loss, but you don't have too much progression, in which case maybe that level is safe. So it's not that if you have a testosterone of 1,000 is a problem, and if you're at 350 testosterone, you're actually safe. There's no such thing. You could be at 1,000, be totally safe. You could be at 350 and have a problem. And as you may know, that there is no normal testosterone. A lot of people, of course, if you have a testosterone of 50 to 70, that's female range, that probably is too low. But if it's causing hair loss, you have to make a judgment whether it's worth it to do testosterone or not. But I will tell you, just like a dentist tells you don't eat candy, I'm going to tell you as a hair surgeon, please don't take testosterone, because it's going to cause problems. How much problem? I don't know. But if you're sitting in my office doing a consultation, wanting to do a transplant or wanting medical therapy for hair loss, testosterone cannot help. Your best option is to completely stop it. Now, of course, there's going to be a withdrawal if you stop it. I don't tell you how fast to stop it, but I will tell you that any level of testosterone usually is not good. If, though, you're maintaining your hair, and it's not, you have hair loss, but your medical therapy has been maintained, you're not having much progression, and your testosterone level is whatever range it is, I don't care what range it is, but you're not really seeing the testosterone, you're not seeing the progression of hair loss, then I would say that number is probably fine for you. So I'm not here to tell you to stop testosterone if you're not seeing any significant progression in your hair loss. But the problem is oftentimes by the time you see the progression, it's just too late. It's the testosterone, once it's caused the damage, it's not like if you stop it, it all comes back. Wherever you've lost it down that chain, you can only bring it back up if it's miniaturized with some medicine, and may only bring up this much. If you came down this far, medicine may only bring you this far, or this far, but it's doubtful to bring back here. Now, surgery may bring you back here, but that surgery is finite numbers, and I may think if it's in your crown, for example, if I transplant back there and it expands, we may have to need more and more. That's something called pi r squared, which is the geography of a surface area. If a radius doubles, it's quadruple the surface area. So it's an area that I don't just do with impunity. I don't just go back and go, oh yeah, you've lost some from testosterone, let's stick more there, especially if you're on testosterone, because testosterone is driving more progression, and I'm even more nervous to do your crown then. So these are all factors that I just want you to contemplate, and I may address those with you. In fact, I will address those with you if it's, in fact, one of my staff, all my staff have been trained to ask the first question for a male, are you on testosterone? Or have you been on testosterone? Because I need to know that information as much as have you had cancer or heart disease. It's part of every consultation that I try to do now. In the past, I didn't ask as much. Now I realize how critical it is to know if you're on testosterone, what your testosterone level is, what your hair loss progression is on testosterone. If you stop testosterone, what did you see? These are all the things that I just want to give you some counsel on.